So, as we traditionally do, and as our teacher traditionally do, why we take this time to have a talk and a discussion is because it is the recommendation of the Buddha. In the 5 supportive factors sutta or supportive factors sutta, the Blessed One has given 5 reasons or 5 factors with which you will have to support the practice. The 5 factors are, it should be, you will have to be moral or morality supportive factor, discussion supportive factor, listening supportive factor, and then tranquility supportive factor and the insight supportive factor. Right. So of these 2, the last 2 we have done to the best of our ability in the last 1.5 hours or so. And this time is to first listen to the talk and then the discussion. When I am usually giving a talk, I give a reminder of the morality supportive factor always. The reason is that is the foundation of the practice. Not all, when people usually come to the practice, they come from all the backgrounds. The robbers are coming, liars are coming, womanizers are coming, and drug addicts are coming, and murderers are coming. Everyone is coming. Right? So when they come into the practice, for them to flourish in the practice or improve on the practice, to go further on the practice, the first thing they will have to support is, first thing that they will have to develop is the morality. So when you keep on practicing, see whether that morality supportive factor is developing within you. Which means when you are about to do something which is not accepted by the society, physically or verbally, there will have some sensations, tingling sensations, some reluctance that is developing within you. That is the morality support. Not that you don't do it. You may do it because the habit, because of the push, because of the peer pressure. But still, you have some reluctance within you. And if you see that, the morality supportive factor is developing. Then you can discuss further about it, and you can determine yourself, okay, it is not really helping me, and I don't like this, but still I do it. Next time I should be bit more alert, bit more mindful, and I'm not going to do that. Right? So that way, not that you all of a sudden put a full stop. If you can do that, it is good. But if you can't do that, ensure yourself you work towards it. You support to be more moral. Right? So that way you will be able to improve, develop on morality supportive factor. But we are taking this talk not to talk about morality supportive factor too much. It's just a reminder. And this time we have selected a topic and we are discussing that topic. And we have discussed that topic for some time. And since we did not have a session after November, and most probably we may have forgotten what we have discussed, even I have forgotten, right? So we will just have a summary, we will just refresh what we have discussed. So for that, can I kindly, because our usual host is sick, we will get Kalpika to read it until the fourth perception, right? So can you keep this close with you so that others can hear as well? I can read it, please. Thank you.
Just from the top.
Just from the top, from the very beginning. You can say even the title.
Girimananda Sutta, Discourse to Girimananda Thera, Thus have I heard. On one occasion the Blessed One was living near Savatthi at Jethavana, at the monastery of Anathapindika. Now at that time the Venerable Girmananda was afflicted with a disease, was suffering therefrom, and was gravely ill. Thereupon the Venerable Ananda approached the Buddha, and having saluted him, sat beside him. So seated, the Venerable Ananda said this to the Blessed One. Bhante, Venerable Sir, the Venerable Girmananda is afflicted with disease, is suffering therefrom, and is gravely ill. It were well, Bhante, if the Blessed One would visit the Venerable Girmananda out of compassion for him. Thereupon the Buddha said, should you, Ananda, visit the monk Girmananda and recite to him the 10 contemplations, then that monk Girmananda, having heard them, will be immediately cured of his disease. What are the 10? Contemplation of impermanence, contemplation of anatta, absence of a permanent self or soul, contemplation of foulness, asubha, contemplation of disadvantage, danger, contemplation of abandonment, contemplation of detachment, contemplation of cessation, contemplation of distaste for the whole world, contemplation of impermanence of all component things, mindfulness of in-breathing and out-breathing. And what, Ananda, is contemplation of impermanence? Herein, Ananda, a monk having gone to the forest, or to the foot of a tree, or to an empty house, contemplates thus. Matter, visible objects, is impermanent. Feeling or sensation is impermanent. Perception is impermanent. Formations are impermanent. Consciousness is impermanent. Thus he dwells contemplating impermanence in these 5 aggregates. This, Ananda, is called contemplation of impermanence. And what, Ananda, is contemplation of anatta? Herein, Ananda, a monk having gone to the forest, or to the foot of a tree, or to a lonely place, contemplates thus. The eye is not the self, visible objects are not the self, the ear is not the self, sounds are not the self, the nose is not the self, smells are not the self, the tongue is not the self, tastes are not the self, the body is not the self, bodily contacts, tangible objects are not the self, the mind is not the self, mental objects are not the self. Thus he dwells contemplating not self in these internal and external bases. This, Ananda, is called contemplation of anatta. And what, Ananda, is contemplation of foulness? Herein, Ananda, a monk contemplates this body upward from the soles of the feet, downward from the top of the hair, enclosed in skin, as being full of many impurities. In this body there are head hairs, body hairs, nails, teeth, skin, flesh, sinews, bones, marrow, kidneys, heart, liver, pleura, spleen, lungs, intestines, intestinal tract, stomach, feces, bile, phlegm, pus, blood, sweat, fat, tears, grease, saliva, nasal mucus, synovium, oil lubricating the joints, and urine. Thus he dwells contemplating foulness in this body. This, Ananda, is called contemplation of foulness. What, Ananda, is contemplation of disadvantage, danger? Herein, Ananda, a monk having gone to the forest, or to the foot of a tree, or to a lonely place, contemplates thus. Many are the sufferings, many are the disadvantages, dangers of this body, since diverse diseases are engendered in this body, such as the following: eye disease, ear disease, nose disease, tongue disease, body disease, headache, mumps, mouth disease, toothache, cough, asthma, cataract, heartburn, fever, stomach ailment, fainting, dysentery, swelling, gripes, leprosy, boils, scrofula, consumption, epilepsy, ringworm, itch, eruption, tetanus, pustule, plethora, diabetes, piles, cancer, fistula, and diseases are originating from bile, from phlegm, from wind, from conflict of the humours, from changes of weather, from adverse condition, faulty deportment, from devices practiced by others, from karma vipaka, results of karma, and cold heat, hunger, thirst, excrement, and urine. Thus he dwells contemplating disadvantage, danger in this body. This Ananda is called contemplation of disadvantage, danger.
Right, so those are the perceptions that we have discussed so far, right? So if we take a summary of that, take the circumstances under which he is providing these perceptions. The first thing what happens is Venerable Ananda comes and tells the Blessed One that so and so is sick. Now it is better you go and see him, and then he will be able to recover. Then the Blessed One, it is not properly given here. Blessed One is when Venerable Ananda is saying he's saying he's afflicted with disease and he cannot bear it up. He is so gravely ill, right? And what does that mean to the Blessed One? Blessed One is a surgeon. All right. Now, in books, they say, Satahata Bhava Dukkata Vedana, which means he is a surgeon for all the sufferings created to the living beings because of the existence. So the doctors we have today is a doctor for one thing and not for anything else. Doctor for one part of the body, not for the rest of the body. Doctor for children and not for adults, right? But the Blessed One is a doctor or a surgeon for all the sufferings created to the living beings due to existence, right? And therefore, when he treats somebody, he treats with the best medicine, right? To treat with the best medicine, as when you go to a doctor, he will use all his equipments he or she has and then checks you. Like that, Blessed One is also checking to give his treatment. What is the check he did? He, to give the right medication, he asked how gravely he is ill, and the presentation itself was, the Venerable Ananda was saying he was gravely ill. What does that mean to the Blessed One? He is suffering from so much of pain. Blessed One knows he is suffering from so much of pain, right? Pain means the opening to the mind, right? It is the opening up of the mind. In other words, he has gone beyond the body, right? Otherwise, he will be saying, my hand will be aching, or my leg will be aching, my knee will be aching. That is what you say. When I was sitting, my knee was so painful. You are still with the body, right? Or you will say, my back was so painful. You are still with the body. But now here, when he was present, he was gravely ill. He is about to die. So ill. So which means Blessed One realized, okay, he has gone beyond the body. His mind is open. Mind is open means all this. He is now observing the sensations. But those sensations are not pleasant sensations. He is observing now so unpleasant sensations. Then the Blessed One realized, okay, he has opened up his mind. Now it is time to give medication to his mind, right? To bring the correct perspective to him so that he will be able to have some relief from it. And he is such a wonderful doctor. He says, for that, there is no need for me to go. You yourself can do it, Ananda. And these are the 10 tablets I am giving. Go and give it to him. Ask him to take the way I am asking him to take. Right? But when these 10 perceptions are given, and even today, when people fall sick, they recite it. Right? When Bhante had fallen sick before coming to Australia, and after he was released from the hospital, about 70 monks and the rest of the monks residing in the monastery, about 100 monks altogether, have chanted this and the other. There are 3 or 4 other suttas as well that you can recite when someone is sick. And he says it was so overwhelming, right? So when you have really practiced these things, and when you really know these things, and when you really hear those things, your mind gets naturally deconditioned. The deconditioning process is happening when you recite these things, and when you really know, and when you are able to live with those perceptions, right? Okay, that's not what I want to tell you. What I want to tell you is to give the summary, right? So when we hear these 10 perceptions, to the people who are not seriously practicing mindfulness, right, they get mixed up, right? They understand that this is a separate way of practicing and we should do this practice. That is a bit of a confusion, right? Why I say it's a confusion? Because it is not told to everyone. It is told to one particular person under given circumstances. In that particular circumstance, Blessed One has selected, yes, this is the right medication and it should give that. And we are not sick, we are not monks, we don't have the Blessed One, but still we try to do that. It will not work. The reason is, for that to work, we should be in those particular circumstances. Mainly, you should be a full-time practitioner. You should be with a teacher. Then, of course, if you fall sick, you can do these things. Otherwise, these are not recommended to be practiced as a separate meditation technique. Not that they are bad. There are practices that are suitable for us, which we are doing, which is walking and sitting, right? Okay, so that we have discussed in the past. We should not consider, in one way it is a different technique for those people who are able to do it. For us who are not under such circumstances, not necessary to take this as a separate practice and do it separately. And if we take the perceptions that we have discussed 4 perceptions. The 4 perceptions we have discussed are impermanence or the inconstance perception, and the second one is non-self, third one is the repulsiveness, and the fourth one is the danger or the risk. By these 4 perceptions, what the Blessed One does is, he is doing 2 things. One is, he is starting at macro level, what suffering and how our mind works and how our existence take place, and then quietly dissect into micro level, right? That's one thing he is doing. And the other thing he is doing is he is quietly paving the way for him to realize the true nature of what is happening, right? So if we take the first one, true nature, what is happening, in the sense, we all live with perceptions. We are in a world full of perceptions. What is, by the way, what is the meaning of perception? Perception means the ways that we have to distinctly identify things. He is a friend for you all, and he is son for his parent. He is sibling, brother for the siblings, right? And when he goes to workplace, he is another workmate, same man, but distinct identification. So we have various ways of distinctly identifying people, and those are called perceptions. So when you live in the world, we live with perceptions only. Education system is heaps and heaps of perceptions, right? Our legal system, heaps and heaps of perceptions. Economic system, heaps and heaps of perceptions, nothing but perceptions, right? Whether they are good or bad is not our question now. What the Blessed One is trying to do is, because of these perceptions, there are few very fundamental perceptions that have been built up or generated in our systems. The main fundamental perceptions that we have generated or established in our system is the permanence perception. We have the perception of permanence, right? That is why we do all these things. We think that things will last forever, right? So that is why maybe when you are practicing, when you can see few breaths, and after time if you can't observe any breath, then you will ask, I was able to be mindful for about 5 minutes, and then after that I was not able to do it. That is because you have the perception that it will be permanent, right? He is answering that. He is telling Venerable Ananda, go and tell Venerable Girimananda, everything is impermanent, right? What is everything? He says, all the aggregates. We are, when we take a human being is having three main ingredients or three main components. The three main components are physical process, mental process, and the interaction of the two. And those three main components, Blessed One is dividing into 5, right? And those 5 is what she said: physical process, and that is the form, and then sensations, and then perceptions, mental volitions or formations, I think maybe the word that has been used there, and the consciousness. All right, these 5 are together. When these 5 are together, we think it is permanent. I am here. Oh, how do you say no? Nothing is happening to me. It looks permanent. But he says, yes, looks permanent, but it is not that. These aggregates are so impermanent, it's changing so fast, you can't even see. Simple example is, we were not born like this. We were born like, maybe when we were born, maybe 1 foot long. And how many kilos usually? It's about 3 kilos. I'm 74 kilos now. When did that happen? Every fraction of a second it is happening. We can't see it, it's happening so fast. That Blessed One says, I just mentioned only about the form. Other things are even faster, right? So therefore, he says it is inconstant, right? Impermanence. And then the non-self, and then that macro, he gives the macro level, and then quietly brings the attention to a bit of a micro level. And there he says, take your body, which is fallen sick, right? And this body is having these components. What are the components the body is having? Eye, nose, throat, and he has taken all the faculties, and he has also taken the external objects that relate to these faculties. And he says, none of these are self. Why none of these are self? You can't control your eye. When you are looking at one thing, naturally without your knowledge it will go to something else. Or when you are watching something, if you hear a song that you like, ear will go even without your knowledge. If it is self, you can control. If it is self, I will not be like this. I'll be having, what do you call? What do you call it? 6 packs. In my tummy, I will be a buff guy. If I can control, there is no self. These things are happening due to some cause and effect relationships only. And therefore he says it's neither your faculties nor the objects that are governed or that are relating to those faculties, that are subject to those faculties, are self. Right? And then he goes on to the next one and tells Venerable Ananda to go and tell. He takes one more step further from the body. He brings further down to a micro level and then says, in this body, not just eye, nose and throat, those main faculties. There are 32 parts in this body, none of which you will keep if it is separated. Right? Head hair, how many times have you cut your hair? Have you brought any of those hair home? It was in your head. Right? Even what is fallen on the shirt, you will just wipe it away. And before you guys came, I had a shave and then I had to clean the toilet. Otherwise, when you go to the toilet, yay, it's the first thing that naturally comes up. That foulness is there. It is beautiful. It is so nice when it is together. But if it is separated, it's a big problem. Right? So it just reminds that. And similarly, the next thing, the last thing that we discussed in the last session was danger or the disadvantage or the risk. It's another micro level. He says this body, which were mainly started with aggregates, and then he went into the faculties, and then he went into the went on to the 32 foul parts of the body, and then he says, you are sick. He tells Venerable Ananda, go and remind him, such a thing that you are having is sick. And that is the risk of having the body. That is the consequence of having body. We may not be sick now, but that vulnerability is there every fraction of a second. We don't know when we will fall sick. And he has given a list of diseases 2,600 years ago. Doctors and researchers are still looking for diseases. He has given the entire list. He has given the entire list. Even cancer, even epilepsy, and many things he has given there. And people say cancer has been found recently. No, even Lord Buddha has mentioned about cancer. Right? Those are there, and he is bringing the attention to the danger. And we think when we fall sick, it should not happen because I have been taking all the precautions. How can I fall sick? Anybody can fall sick. And in that way, he is bringing gradually from the macro start to a micro level, and let Venerable Girimananda understand the situation he is in. Now he is quietly paved the way for the teaching of Dhamma, for understanding of the Dhamma. Right? So today's topic is the next perception that we have got to discuss, which is abandonment perception. So can you read that please, Kalpika, for me? You will have to open it up again, please. Yeah, you can start.
And what Ananda is contemplation of abandonment. Herein, Ananda, a monk does not tolerate a thought of sensual desire that has arisen in him, dispels it, makes an end of it, and annihilates it. He does not tolerate a thought of ill will that has arisen in him, but abandons, dispels it, makes an end of it, and annihilates it. He does not tolerate a thought of cruelty that has arisen in him, but abandons it, dispels it, makes an end of it, and annihilates it. He does not tolerate evil, unprofitable states that arise in him from time to time, but abandons them, dispels them, makes an end of them, and annihilates them. This Ananda is called contemplation of abandonment.
Yeah. So that is what we are going to discuss today, right? Abandonment, and which we call in Pali Pahana Sanya. In this contemplation, he is mentioning a monk does not tolerate a thought of what? Of sensual desire, uh, of thought of ill will, thought of cruelty, or thought of any other unskillful activities, acts. So now he is not talking about the body, he is not talking about the foulness of the body, he is not talking about the dangers of the body. Now he is talking about the mind. Why he is talking about the mind is, now he is asking Venerable Girimananda to go and contemplate. When he goes and contemplate in the forest or under a tree or in a secluded place, he is so sick. What is the first thing? He will generate so much of thoughts. What is the first thing he will generate? What's the first thought he will get? When you are so sick, if I call you and ask you to go and, okay, go to your shrine room and sit cross-legged and then start contemplating this or observe your breath, then what is the first thing that comes to your mind? That guy must be crazy. He thinks I am in a situation to meditate. So in other words, the first thought that the Venerable Girimananda would have is, Buddha must be crazy. Right? Well, ask him, he's gravely ill, and ask him to go and contemplate. So those when Lord Buddha is very well aware of it, and then he says, you will get those thoughts. Now you are not really going and blackguarding him or scolding him, shouting at him or throwing stones at him, but those thoughts will arise. Or if he feels he is recovering, or some other desire thoughts might come up, right? Or any other unskillful thing. He will, unskillful in the sense, he may start suspecting the practice. I am a monk and I came here to do and observe, be mindful, and then cross the existence or the sansaric journey, and it is not happening, and he is asking me to contemplate even when I am sick. If he is so powerful, why can't he, use his magic hand and cure me? And all those unskillful thoughts may arise. Right? Once again, I am reminding, these are thoughts. The mind is working now. So then the Blessed One says, if those things arise because you have been practicing, why? He's a monk. He has been practicing for a long time. Because you have been practicing, you know that these thoughts are not good. You have been practicing, you have been listening to talks of the Buddha and other monks for a long time, and then you have been discussing. So when these thoughts are arising, you know they are not good thoughts, right? Then when those thoughts are not good, what you try to do within you is, you try to abandon them. How do you try to abandon them? Is this is giving three words. Has arisen in him. He tries to dispel it, finding ways to dispel it and makes an end to it. Try to finish it or somehow or other, and annihilate it, and does not tolerate. When those, it may be ill will, or it may be a sensual desire, it may be a cruel thought, or it may be any other unskillful thing, he will do any of those things and try to avoid them, abandon them as much as possible. And that abandonment or taking any action is fine. Is fine to a person who is practicing full time. Not for us. And although I say not for us, Some of you can do that because some of you have been practicing seriously for a long time. So when these things are happening, when you are sick, you can use this. You can try to dispel them. You can try to abandon them, right? You can try to end them, right? But it should not be taken in isolation and should not try to do it only when you are sick. If you have been a continuing practitioner, then you can do that. Okay. We will see how this relates to our practice. If when we yes, when these thoughts are coming, these thoughts are not just coming randomly, they come in a very deceitful manner, in a very cunning way, and then try to grab your attention, try to take your awareness completely into that, and it will try to take you away completely from the practice, right? Say for example, when you are sick, and if you practice like this, and you may feel the best thing that has to be done is, instead of observing my sickness or instead of observing the thoughts that are arising, I should go and sleep, then have a good rest, right? And logically it is acceptable, but what mind is trying to do is just to take you away from the practice, right? So therefore the thoughts that are coming, the ideas that are coming, going to bed is neither a sensual pleasure, or is not a thought of a sensual pleasure. It is not cruelty, it is not ill will, but it is an unskillful thing, right? So therefore the Blessed One says those things will be coming in a very deceitful manner, and it will arise as a knowledge, it will arise as a wisdom. And most of the people I know, when they have sicknesses like this, they without practicing, what they do is straight away go and recite all these things. That will not work, and it is better rather than sleeping, but it will not work. And but still they will have an argument, we are doing this because this has happened to Venerable Girimananda, so we are just doing that, right? But actually, if you take the practice from what we are doing, what happens is, in the abandonment, we are practicing abandonment in when you do your mindfulness, and the practice of that abandonment is what will actually evolve or come up when you fall sick, right? How that will happen is, when you come here to practice while walking and while sitting, straight away you won't be able to take your attention to your meditation object or the practicing object. You will not be able to observe your breath, or you will not be able to observe your walking. Instead, you will be having a lot of sensual thoughts. You will be having a lot of ill will. You may be having all other sorts of thoughts that are coming and disturbing you. When they are happening, what do? What we try to do is, when those disturbances are there, we try to observe our main object as long as possible, right? So when we develop that skill, not that the disturbances are not there, disturbances have come from the thoughts, they are there, but while they are there, you try to observe your main object. When you do that, what happens is, you are abandoning what? Abandoning that disturbance that have come to disturb you, you don't give it a chance. You don't take it so serious. You take the main object seriously, and you continuously keep your attention there. So although the thoughts are coming to disturb you, you are not worried about it. You are with the main object. So that is the way we practice the abandonment of such thoughts, right? But there will have instances when such thoughts are so overwhelming and you can't observe the breath at all. You can't observe your right foot and the left foot at all, right? When that is happening, what you will do is, if it is so overwhelming and if it has become the prime thing in your whole system, then what mindfulness does is, you don't fight with the disturbance that has come, you don't fight with the thought that has come, you will accept the thought as it is. When you accept the thought as it is, what happens is, since you are not fighting with it, it loses its ground. Why is the thought coming? To agitate you, to irritate you, right? So when the thought is there, and if you try to do something to get rid of it, then it will establish, right? Suppose a desire thought is arising, and if you are thinking, oh, this damn thing is coming to my head all the time, I should somehow suppress this, and what can I do to suppress it? Okay, I will think of 32 foul parts of the body, which means you are angry. You don't like that bad thought that is coming up. Aruni, you will have to put the mic mute, please. Hi, Aruni, you will have to put the mic mute, please. Thank you. Right. So that way, when you don't fight with it, or when you don't like it unnecessarily, and when you observe it neutrally, then what happens is, once again, it will not establish, right? You accept the thought as it is, since it is overwhelming, right? Even that way, when it loses its founding or its foundation, it will gradually be abundant, right? So you may have observed sometimes such thoughts are coming, and as we always remind, we observe it, and once we observe, no one has given that as an observation, that fades away. As soon as you observe it, it loses its ground, right? So that is the abandonment that we are training in the practice. So once we train that way, it is easier for you to abandon when such thoughts are arising when you practice, when you are sick, right? So it's not that the abundant perception is happening or can be done only when you are sick. You are practicing it even now, right? That ability can be directly applied in the way that the Blessed One has explained in the sutta, right? So that is what I want to talk to you about, the abandonment perception, and the fifth, I think it is the fifth perception of Girimananda Sutta, and we will take the next one in the next session. And now from here, abandonment perception onwards, it is now changing into spirituality. It is now changing into actual practice. It is now changing into how you will purify yourself. When you learn to abandon these evil thoughts, sensual thoughts, and cruel thoughts and unskillful thoughts, It's a way that you will train your mind to get rid of unwanted things, right? So therefore, it becomes part of purification. So the other perceptions that are coming up are much more towards the practice. So with that, I will conclude the talk. So we can take few minutes now if you have any questions on the talk or regarding your practice.
I'll say something.
Yeah.
So I gave a report. I gave a report to Bante last year, just after the retreat. I also got sort of a recent report. I'll give both. In the walking, I first check for evidence that I am walking, specifically the contact of my soul on the ground. I cannot feel it, nor can I feel the motions of my legs or the lower half of my body or my back. I remain vigilant and keep observing. Generally, one of two things happen: a continuous stream of thoughts or a vast emptiness. To make easy to explain, I will give this analogy. The mind's home is the vast emptiness. This is where he lives. There are no real characteristics of the house, just that it occurs in the absence of other objects, or you could say, all objects in the background and none taken. Mind doesn't always stay at home. He visits other people's houses, for example, the house of thoughts. I can never see mind leaving home and entering another house, or you could say transition to another object. It is usually after consecutive thought moments that I come to know that the object has shifted. I find no problem with mind going elsewhere, and at some point in time he will return home to the vast emptiness. The sitting occurs in much the same fashion, so I'll keep details short. I start by checking for evidence that I am sitting. I can't feel the brushing sensation of air at the entrance of my nostrils, nor can I feel points of contact in my body or rising and falling of my stomach or my back. I remain vigilant and keep observing. I observe mind's home and his house visits, just like the walking. The only other thing that I observe is there is a house of pains, I guess, which doesn't occur in the walking. I also observe on occasion something else in mind's house, or the vast emptiness. There is another layer, or you could say a basement. I do not know the characteristics of this basement. The only thing I know for sure is that I cannot verify anything that is happening there.
Right.
Did I give his response?
Yeah.
So he gave a very good response, but I forgot almost immediately. It was a very long sort of thing that he said, but he didn't blast me, which was good. So he said he's talking about reductionism and system approach. They're both happening. When reductionism happens, you can know with inferential knowledge what the system is doing. And both the reductionism and system approach are happening or changing from one to the other, and you have no say. He did say something else which I can't remember, which was quite important. And the other point he made mention is he said that I can view dependent origination, or that I'm ready to see it, but I have very limited theoretical knowledge on.
Right. So what is the question now?
No question.
Right. Okay. Right. Okay. It's just a statement.
Yes.
Right. Okay. Any other comment, questions? Anything that you want to say about your practice? How your walking is going, how your sitting is going?
I've got one question about the discussion today.
Yeah.
With the abandonment side of things, you're sort of talking in relation to the practice.
Yeah.
I was just wondering how that, for someone who's just starting out in the practice and the practice isn't day-to-day life for them, how it maybe would relate to your life, or maybe changing your way of thinking without it or is it purely relative to the practice and nothing else?
Yes, it is the last one. It's related to the practice, nothing else. Don't try to do it forcefully, right? Don't try to, that is why I said at the very beginning, don't take it as another meditation practice. Don't impose it upon you. You just keep on practicing the normal way that you are practicing, and when your practice develops and those abandonment what do you call thoughts or abandonment perception will develop, right? So when sensual thought is arising, sensual thoughts are arising, right, while practicing, right? When they are arising, first thing what will happen is you get panic. You forget the meditation object or the mindfulness object. You forget the instructions given when such things happen. First thing that happens is you become panic. What is happening to me? What am I thinking? Why can't come out of this? And the entire sitting will go like that. Not just one day. And if you continuously practice, it may happen for so many days or maybe months, right? That is the way how your stock inside, the stock that you have developed is coming up, right? And that is the way you know how to handle. When something happens, only thing we know is to react, and now you can't react, you just become panic. Doesn't matter, let it happen, but you will have to discuss, you will have to talk about it, right? But after some time, because of these discussions and because of this listening supportive factor, what happens is, one, there will have a point where you become less panic. When you become less panic, it is also a change of perception, right? And then it will come to a point you are not panicking, but still the thoughts are coming up. They don't stop, and you will never be able to take your attention to the main object, right? Then what you will do is, you have heard the instructions given. Okay, now this thought is coming. Can I see that thought has already come? And the next thought moment, you see whether you can observe the main object. First you have observed first you have seen the thought has come, but you are not panicking now. In the next thought moment, you see whether you can observe the thought, observe the main object. And if you can observe the main object, and that thought has also come and it is also there, it is also trying to bother you, but you still can see the main object, observe the main object. It's not as clear as without the disturbance. It is a bit cloudy as well, but still you can observe, although it is not clear, right? So that way, now you are changing your perception quietly and learning the abandonment perception, right? And once you do this, and there will have residues of this stocks, and it will once again come up in such a way that you can't control, right? And even when that happens, then you start again worrying, or earlier I was panicking, and then there was a situation I was not panicking and I was able to observe when it is there. But now, once again, it has come up. Now you don't panic, now you worry, because you have seen both the sides. Now you have been a side where you will be able to observe it and you will be able to manage it, you will be able to control it. And on the other hand, you have seen you have been completely, totally kicked out by the disturbance, right? And then when the third time when it is happening, you are not panicking, now you are worrying because you are unable to do what you did, right? Even that will go on for some time, right? Then once again, because of these discussions, because of your continuous practice, because of the faith you have in the practice, and because of listening, you say, okay, I'm unable to focus on the main object, but till the thought is coming, mindfulness means here now I am, only thing I have to do is, without panicking, without worrying, just to accept it, right? And once you accept that, again it's again a change in perception, perception of abandonment, right? So that perception of abandonment gradually start developing and gradually start improving and gradually evolve into such a level that it will cascade down into your normal life. So that there will have instances where when you are driving, there is a nice girl going on the other side, naturally your attention will go there. Then immediately you become aware of it. Immediately you become aware of it, because that perception is there. Abandonment perception is working now, right? To see that it is working, that has to happen. And when someone you don't like is there, immediately you get, I feel slapping that, right? That will come to your mind, right? And then immediately after that, you feel, you observe and you become aware that such a thought has come, right? So that way, abandonment perception will develop, evolve. We call it pahana sanya, which means you avoid, dispels those things. Not actively, not intentionally. We have done the practice in such a way those things will come up when necessary. So therefore, the second one is the answer. I just explained a bit further how it happens. So don't expect it overnight. Keep on practicing. You yourself will see after few years, I am not the person who started.
Thank you.
Welcome. Anything else?
We'll give a report.
Yeah.
What's happening now? I found that my practice was fixated unintentionally on the vast emptiness, trying to pursue and hold on to it. The reality is that it is impermanent. I cannot stay there indefinitely, as it is arising and ceasing of its own accord. It is no different to the characteristics of any other object. The only other thing worth mentioning is what happens when I intentionally view an object, or you could say get closer, or see reductionism. The object ceases immediately. But when I view the system, everything is happening in a natural way. I have observed some things like this in the past, but the difference now is that no build-up in mindfulness is required. This is happening without the need for retreat atmosphere or formal walking and sitting sessions.
Okay, so that is a statement.
Yes.
So what it says is, to see whether I understood it, even in day-to-day activities, general living, you are in vast emptiness.
It can happen.
It can happen.
Yeah.
Right. If it is not happening,
Then there might be objects.
there, whatever that is, there will be there. Right. So this is there any question in this?
No.
Right. But when you were saying, can you read the second or first and the second sentences?
At the very first of it, I found that my practice was fixated unintentionally on the vast emptiness.
That's right. Second one?
Trying to pursue and hold on to it.
Yes, that is important. Trying to pursue and hold on to it is the way you have now gone away from the craving towards the breath. Gone away from the craving or fighting with your sensations, right? You have moved away from thoughts as well, right? Now what is there is just emptiness, right? Nothing is there, but you can see a container which is empty. Earlier, breath was there, sensations were there, thoughts were there. Now these things may be there, but what you can mainly see is the emptiness. For example, if you take this room, what is most available in this room is emptiness, right? But when we look, our attention goes to individual people sitting here, right? But if someone develops their way of looking at things or observation or their attention to see through the existing material things, you can see the vast emptiness, right? So the breath may be there, or breath is definitely there, but it's not prominent. Sensations are there, but it's not prominent. And thoughts may be there, but they are not bothering us. But you can see that vast emptiness, right? So you have moved away from the craving towards those things: breath, sensations, and thoughts, right? But now that second sentence says you are trying to hold on to it. What? The emptiness. Craving has now gone there, right? Nothing wrong in that. You have been mindful of it, and that is why you have written it. The next thing is, I will say two things. One is, when you are in the emptiness, be mindful that you are in the emptiness. When you are not in the emptiness, be mindful that you are not in the emptiness. Those are the two situations or the realms or the spheres that you will have to handle now. Emptiness, aware, not emptiness, aware, without any change in your attitude. You should be able to observe the emptiness with a certain level of happy mentality, and the same happy mentality must be there even when the emptiness is not there, right? That is the first thing. The second thing I want to say is, which I have forgotten now. Yeah, it will come up. If it comes up, I will tell you. There are two things I wanted to say. The first one is, the second one is, without your involvement, you will crave for it, as you have written. If you see that craving is there, just become aware of that as well. Now it's a sensual thought for the emptiness, not other things, right? So if it will come up, right? Just be aware of it, right? And if it quietly vanishes, just keep observing that, right? Don't specifically try to do anything, just the awareness of those three things will make you more closer to it. And when you are in the emptiness, try to not just be aware, try to get more close to it, go into it, and your attention is not going into it because you have some sort of a liking towards it, and it's a situation where anybody may like, because you have not experienced that in the past. Once you experience, you know it is so peaceful, and you try to hold it. There is nothing wrong in it, right? But once you, as I said earlier to Dean, these are certain things that are happening in the practice. So let those things happen. Be very patient and keep those things in mind, and there will have a point where, without any additional thoughts, without any additional disturbance, you will be able to observe. So keep